Good evening, guys. I have a bonus one for you. On discussion F discusses a day in the life of a hospice nurse. So we're going to go through that for the presentation F tonight. Okay, here, being a hospice nurse is not a job. It's a deeply emotional calling that blends clinical expertise with profound compassion. Each day brings a mix of medical care, emotional support, and human connection, often in the most vulnerable moments of a patient's life. Here's a look into what that journey entails. Starting the day, preparation and mindset. Hospice nurses begin their day with emotional readiness, as described in Navigating Emotions, a day in the life of a hospice nurse. Many rely on mindfulness, prayer, and quiet reflection to prepare for the emotional weight of their work. Planning visits with flexibility is key. Some patients may need extra time due to complex family dynamics or symptom management challenges. Patient visits, clinical patient visits, clinical care meets compassion. Each visit involves more than just checking vitals. Nurses assess pain and symptoms, coordinate with physicians, social workers, and aides, ensure medications and supplies are available, provide emotional support to patients and families. The video, A Day in the Life of a Hospice Nurse, offers a first-hand look at how nurses manage logistics like mileage reimbursement and on-call visits while still maintaining a calm, caring presence. Emotional support, holding space for grief. Hospice nurses often witness raw grief and fear and coping with emotions in hospice care. Nurse Hadley shares her how she navigates sadness and emotional intensity, emphasizing the importance of empathy and presence. Similarly, how to handle emotional stress during hospice. Elder explores strategies for managing emotional fatigue, including self-care and peer support. On-call death visits, being there when it matters most. Death visits are among the most emotionally charged moments. Nurses confirm death, contact funeral homes, offer comfort to grieving families. Hospice nurse, a day in the life of a hospice nurse walks you through these moments, showing how nurses juggle tragic calls, medications, protocols, and wound care, all while maintaining dignity and compassion. Time management and flexibility. Timing is everything. Day in the life of a hospice nurse. Nurses discuss how unpredictable the day can be. Scheduling must allow for emotional space, especially when a patient or family needs more than just clinical care. Real life glimpses in the human side of hospice nursing. What being a hospice nurse is really like offers a candid view of a 24-hour shift, showing how nurses balance traffic, patient needs, and emotional resilience. It's a reminder that behind every clinical task is a human story. Hospice nursing is a blend of science and soul. It's about showing up fully present for people at the end of life and doing so with grace, skill, and heart. Hospice nursing is a unique blend of clinical precision and emotional depth. It demands not only medical experience, but also a profound ability to connect with patients and families during life's most vulnerable moments. Here are the key skills that define an exceptional hospice nurse: clinical expertise, pain and symptom management, mastery in assessing and alleviating physical discomfort is central to hospice care. Palliative care knowledge, understanding end of life protocols, including medications, administration, and wound care. Crisis intervention, ability to respond calmly and effectively during emotional or medical emergencies. Communication skills, clear and empathetic dialogue, explaining complex medical information with sensitivity to patients and families. Active listening, uh, create, uh, creating space for patients to share fears, regrets, and final wishes without judgment. Interdisciplinary collaboration, coordinating with physicians, social workers, chaplains, and aides to deliver holistic care. Emotional intelligence, empathy, and compassion, offering comfort and presence during grief, fear, and uncertainty. Emotional resilience, managing personal stress while supporting others through loss and transition. Patience, respecting other patients' peace and emotional state, especially when care is slow and respective. Organizational, ethical skills, time management, balancing unpredictable schedules, on call duties, and urgent visits with grace. HIPAA compliance, maintaining confidentiality and ethical standards in sensitive situations. Advocacy, championing patient dignity, autonomy, and comfort in every decision. These skills aren't just learned, they're lived. Hospice nurses often describe their work as a calling where technical ability meets the art of human connection. If you're exploring this path or simply admiring those who walk in it, this these qualities are the heart of what makes hospice care so powerful. To become a hospice nurse, you'll need a combination of formal education, clinical experience, and if you choose specialized certification, here's a clear breakdown of the path. Earn a nursing degree. You must first become a registered nurse by completing one of the following: associate degree in nursing, or ADN. Typically takes 18 months to 2 years. Bachelor of Science in Nursing, BSN, a 4-year program that offers a broader career opportunities and higher pay. Pass the Nexus RN exam. After graduation, you must pass the National Council licensure exam for registered nurses, or Nexus. To obtain your RN license, obtain state licensure. Each U.S. state has its own licensing requirements. You'll need to apply through your state's nursing board to practice legally. Gain clinical experience. Most hospice employees prefer nurses with bedside experience, especially in areas like oncology, geriatrics, palliative care. This helps you develop the emotional resilience and clinical judgment needed for end-of-life care. Optional, get certified. While not required, certification can boost your credibility and job prospects. Okay, guys, Being in hospice is not an easy profession. It's not. It's not. It's for those who really care about elderly people and care about the process of helping them pass with dignity and personalization at the end of life. It's about giving them what they want um, for last opportunities. Um, it's about sending them out with the best life possible. Okay. With that being said, um, Gator Wellness, take care, folks. Hi, Pammy.